There's a real problem across the state. We talked about healthcare. There is hardly a free market anymore in healthcare, so the wishes for people who wish we could go back to something like that, I would just urge you to keep wishing. We have developed a system in Minnesota where approximately 60 to maybe 70% of hospitals are facing payment rates paid for by the state and the feds. If they reach cost, you're lucky. Sometimes it's even below cost. We used to cost shift from the private market, which is not very big anymore. And so many hospitals and hospital systems find themselves in harm's way. You don't have to look very far in your own locale to see such a hospital. And they are, as hospitals are deeply dedicated to the services, to the people who need their service. What has happened, however, has more and more consolidation has happened, and more large groups are running hospitals. And despite the commitment of the locals, it seems many decisions are made that are more in the interest of the math as opposed to service. And you have to pay the bills, Mr. President, as every hospital knows. There was a time in the recent past, 10 years ago, and even more recently, where hospitals actually had a profit margin. That is more difficult now between COVID and everything else. And so in my particular area, the hospitals, we're going to close some services, and it was the opinion of many people, including the doctors and nurses who were connected to that, that was actually not a good idea. And so this provoked a whole discussion about how then should we decide if it's okay to close a hospital. In Monoman, the hospital closed the emergency room, or closed the hospital part, because they couldn't, they had very few guests, and it was decided to keep the ER open so you could have emergency services out there. And onlookers would say, like, that probably doesn't make sense. It's too bad there's no services there, but there's no people really going. In other areas, they closed Foston, which was a big stir. Some years ago, the Mayo Clinic closed their obstetric services in Albert Lea, still to the chagrin of the Albert Leeites, where they had to go to Austin to get their maternity care. And so how do you balance the math with the mission? I believe, like, an example of another hospital that's challenged these days is North Memorial, which I believe has a high, strong commitment to mission. And they're in trouble, but they're doing everything they can possibly do to serve the people who need their care. In other cases, it seems like it's more driven by motives that are not so connected to service, but to more of a math problem. And this happened out our way in the Mercy and Unity situation. And so the question arises, who then should be the accountable party to help decide, is it a good idea to truncate services at all? And should you leave it up to the corporations? And I'm not here to bash corporations necessarily, but corporations have a duty to their own, to the people who are running them, even as a nonprofit. And so I'm not even going to go into the corporate questions so much about who's to blame about that, but who should decide? Should the corporation be allowed to decide what they're going to do? As we get more and more consolidation, I'm going to suggest, Mr. President, that someday we're going to have a company called BizHealth, which is going to run most of the hospitals in the state and 80% of the doctors and nurses, and they're going to decide who gets what for health care. That's some down the road, and there's no company called BizHealth, but I'm just predicting the future 10, 20 years from now as things consolidate more and more. And who should decide, Mr. President, that your citizens don't need care in a reasonable distance from their homes and adequate at that? And so it occurred to me, working with nurses and doctors and locals and Representative Kegel, excuse me, it is late, and others, to find a way that would truly be reasonable to do. And the only entity in this state that I could think of, and I would happy if somebody else think me of a better one, is the Department of Health. Mr. President, I have not been a Department of Health aficionado every day of my legislative career. They do some things well. We've had all kinds of discussions. But in this niche, I believe they are the best suited to adjudicate the question, is this in the public interest? Now, when we cite a hospital, there's a public interest review, which takes a long time, and they've not always been successful in deciding. But I think in terms of their stature, and they're generally trusted and with expertise in this, that they should be the ones to decide, is this a reasonable move that will serve the community interest and provide adequate care? And so, just in case in point in the particular local thing at Mercy and Unity, the decision was to close the overnight pediatrics unit. Okay, well, what does that matter? Well, there are cases you need a unit pretty in a reasonable place that's close enough to home. And so you're like, well, just send them to Children's. But Mr. President, what if Children's doesn't have space? And this decision was made without any agreement with any other auxiliary places for people to go. To me, that seems like that's not in the community interest, and I believe it should not go forward. And so what the amendment asks for is that if this particular company, and I'm refraining from using their name in the interest of just being a good sport, they would bring their idea forward that they want to close an operating room and an intensive care unit at one building and close the overnight pediatric service at the other building, and indeed, can they consolidate and have enough room? And will there be enough service capacity to meet the capacity that they've met before? And why is that important to even ask somebody that question? By consolidating and assuming the service controller for a region, they, in my view, they've taken a responsibility and a mission to serve that area. And so, Mr. President, what the amendment calls for is actually an expedited review. This company would then submit, or any hospital, before it truncates services in a notable way, would submit a plan to the Department of Health on their plan and what the alternatives are and so on privately. This would not be a public process. And then they would get feedback and be told, well, maybe you can close, maybe you don't need the ICU, but you need an OR, and you should keep the pediatric beds, but at least you better keep 5 of them. And then that would become the plan that would go forward, serving the public interest. And so this is coming to us, if it hasn't come to your neighborhood, Mr. President, whether you're in Minneapolis or if you're out in Biwabik or Worthington, it's going to come soon, where these decisions come. And I believe that we need to be sure that people get the care that they are expecting to get. And so with that, Mr. President, I'd request a roll call, and I would request a green vote. So let me explain to you what happens when one of these organizations is going to close a part of your hospital. They decide they're going to do it. They inform the staff, and they have a meeting, and they take comments, and then they do it. At the meeting we had for Mercy, in particular, closing the pediatrics overnight unit, there was a parent who popped in. Most of the testifiers were actually professionals working at the doctors and nurses who actually I thought were really concerned about what was going to happen. But the man talked about his child, I don't remember if it was a daughter or a son, under age 1 who had some emergency and came to Mercy ER, and they had a bed to put him in, or her. And they could have gone to Children's, which would have taken another hour, and they went into Mercy, and they made the trip down to Children's, the baby would have died. All the doctors agreed that it's lucky they had a bed to put him in, or her. And so when that story came up, the corporate officers were like, oh, well, thank you for sharing that story. And how many stories like that do you think that we ought to have? And do you think that, God bless corporations, but we've moved more and more into corporate-run healthcare and less on the mission side. And do you think it's reasonable that a company can decide they're going to close because of whatever reason they don't need this service anymore, and then not have any available anywhere in the metro? Or take them to Children's. But this particular company did not even have an agreement with Children's to have 2 beds, 4 beds, or 5 beds, or get some kind of priority care. Is that responsible? Yeah, the amendment it's kind of new. The topic is not new. The solution, we've been trying to work on this between the Representative Cagle and myself, given our situation. But in June, there's not going to be a pediatric bed in the area between Children's and St. Francis, and I don't know where the next one is going north. Is that something that we think should just be allowed to happen? And if it can happen in the metro at Mercy, and what's going to happen in Worthington or Winona or elsewhere? And so, yeah, is it a perfect solution? I don't think so. But I think it's a pretty good idea to have somebody besides a corporate entity who is worried about their math to decide we're not going to have a pediatric bed between Children's and St. Cloud unless we're fine with that. Like, oh, well, and so we talked about it, and it's kind of new, and I'm nervous about it, and well, how will it work? Or instead, we can decide, let's put this bill this amendment into the bill and keep working on it. I've been here long enough to know if there's something in a bill, it gets worked on. If there's something outside of the bill, you talk about something else. And that's my concern. My concern in my situation is that when you talk to the OR nurses at Unity, they say, well, it's not even working. And there's not room at Mercy. They miscalculated the capacity. So who gets to decide that? A company who's worried about the math, and the math matters, Mr. President. And so how do we, but there's got to be mission, there's got to be capacity. And as these places close, they're not going to come back. And it's sure they're private nonprofits, they benefit by all kinds of laws we give them. And so, but if we need to have a way that we can agree on that makes some kind of sense besides doing nothing. When this session comes and goes, by the time June has come, there's going to be no OR in Unity, and there's going to be no ICU at Unity, there's going to be no pediatric beds between Children's Hospital and St. Cloud. And that bothers me. But it's a broader thing than just my little local. It's going to go somewhere else, and people are going to find themselves with a card that doesn't even have a hospital where you're nearby for the urgency you need. And so is it time to wait for the process to come up with some magic answer we have meetings about? This is not any assault on the hospital association or hospitals. This is a way to preserve the integrity of the healthcare system, and then we can find a way to support the hospitals in the meantime by rebasing them, by helping them get their beds unloaded. But if the beds are closed, they're not going to come back. So members, I've not talked to all of you. I've only talked to a few of you about this. The discussion maybe has been in the hallway with various people. Please give this amendment a chance. You heard from Senator Wickland herself. She's open, and I will predict it will not come back harmful with somebody as responsible as her. But if it goes in, it has a chance to get done. If it doesn't, then sorry to the people who want a pediatric. Hope you don't need a bed for your child anywhere in the North Metro. Please, members, vote green. Thank you.
The Secretary will take the roll on the A80 amendment. Members, please vote. Senator Morrison? She needs a minute. That's understandable. Members, please vote. Senator Morrison, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes aye.
Senator Bolden votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umover Baden votes aye.
Senator Umover Braden votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
And Senator Zhang votes aye.
And Mr. President, Senator Dietzig votes aye.
And Senator Dietzig votes aye. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Barr votes no.
Senator Barr votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Draheim votes no.
Senator Draheim votes no.
Senator Housley votes no.
Senator Housley votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Weber votes no.
Senator Weber votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
And Senator Howe votes no.
And Senator Howe votes no. And Senator Duckworth, you can vote. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 31 noes, the A80 amendment is adopted. Senator Abeler, do you have another amendment? If not, I have another person to go to.
Thank you, Mr. President. I think after that I should quit while I'm ahead. I want to thank people for their confidence in that last amendment. I really respect the discussion. And Senator Willickton, thank you for that. Thank you.